husbands are also listening also. They are part of this antenatal class. All right, so today we'll be looking at some common medical problems in pregnancy. We are going to take two today. This class will look at anemia in pregnancy, and then we'll look at malaria in pregnancy. These are very common conditions that can affect a pregnant woman. So the first we'll be looking at will be anemia in pregnancy. When you say anemia, what do you mean? No. To put it in a layman's language, you talk about blood level, the amount of blood level, what we call the packed cell volume, the PCV, of a pregnant woman. And it is very, very important for us to determine what the blood level is of a woman while she's pregnant, because while she's not pregnant, we are not so concerned about her blood level, except when she menstruates so much, she has very heavy periods, and that she gets dizzy, and it can affect her blood level. Other than that, most women, or when they are sick, all right, they have severe malaria and it's been recurrent, or for whatever reason they lose blood, then we can begin to talk about, oh, your blood level is low. And all we need to do is to correct it, look at the cause of it, and then the woman is fine. But it becomes very important for us when a woman becomes pregnant, because she's now carrying a fetus, that she's carrying a human, another human life that needs to be nurtured inside of her. And the level of her blood now becomes very important to us, because it's not just to her alone, but it becomes important to us. And so while a woman is pregnant, we would want to make sure our blood level is not low. We'll be looking at the various parameters that determines whether a blood level is normal or whether a blood level is low. So when we say a woman is anemic or has anemia, it means that there is deficiency in her oxygen carrying capacity. Next slide. In her oxygen carrying capacity, there is a deficiency. In the blood of a woman, the red blood cells, the blood has different cells. You have red blood cells, you have white blood cells, and then you have platelets. But we are looking at red blood cells, the level of the red blood cells. And why are we interested in the red blood cell? Because the red blood cell contains what we call hemoglobin. Excuse me. And it is the hemoglobin that carries the oxygen that goes round the blood, goes round the body, and supplies that oxygen to cells and ensure that everything is going well. So if there's a reduction in the red blood cells, it means there will also be a reduction in the hemoglobin. And that means that the carrying capacity for oxygen will also be reduced. And so that is why when a woman is pregnant, it's important for her to ensure that her red blood cells and hemoglobin are not depleted. And so the red blood cell is produced in the body from iron, from folic acid, and other components in the bone marrow of the red of the bone. So that is where you have these red blood cells produced, and the body keeps on producing the red blood cells as long as the bone marrow is not compromised, depending on the need. And so what that means that for a woman who is pregnant, because of the additional need of cells, of red blood cells, because while the woman is pregnant, she needs to prepare for the day of delivery. So the red blood cell will increase in women that are pregnant because of the increased need for oxygen. The oxygen carrying capacity, the hemoglobin will need to be produced, will need to increase. So all of these things, there's an increase in demand for the substrates, for the things that produce red blood cells, iron, folic acid. And that is why most women, when they are pregnant, they will notice that we offer them supplements.